Welcome, everyone. This is Poor Historians, a podcast misadventuring into the archives of medical history and beyond, except for when we don't do that stuff, and we do stuff like this and our kind of bonus episode drops. I'm Dr. Max, and I'm joined here by my good friends and colleagues, Dr. Aaron.
What?
And Dr. Mike.
Hi.
As well as our medical history intern turned entertainment critic, Elba. Hi, Elba.
That's me. Hey.
And so this month's little bonus episode, the one you're listening to at the moment, is part 2 of our, people wanted us to do these TV show reviews, the TV shows about medicine, and give our critical eye to them and maybe take them down a peg or two. And so we did. And we had so much fun with The Resident episode 1, and some people commenting that, it's just a pilot. Maybe that was the reason. Why don't we watch episode 2 and see if it got better? It did not get better. In fact, I would argue that it got worse. Did you agree with me there, Aaron?
It's so bad it's good, so it's even better, actually. Than the
I didn't say it wasn't
episode.
entertaining. It was, just not for the reasons they thought. And hey, we have Mike here this time who wasn't able to make the last one. And we did have listeners wondering if something bad had happened. We disposed of your body, but nope, he's here. That's definitely not an AI.
You just
That's
watched
real
The
Mike.
Resident. That's only the bad thing that happened to him.
And
Show.
It's pretty bad.
And especially because like Alba, you even said at the end of the last episode, you're like, this was a lot of fun. I can't wait to watch episode 2. What did you think of episode 2?
Here's the thing, Mac. Well, okay, let me explain it first.
Here it goes.
I did say it was so bad that I couldn't stop thinking about watching the next episode. And I did think more about watching the next episode.
Oh, okay.
The thing is, it's finals week, and I didn't watch the episode.
You
I
saying
couldn't
you don't
bear it.
prioritize this show over your finals and education, Elba?
I have mixed up morals, I guess. My
Yeah.
values are all discombobulated.
We're gonna let it go, but appreciate having you along. You can take the journey with us, and then you should watch it on your own time and let us know what you think.
Okay. I think it might be more interesting for me to do it in this direction, hearing about it from y'all first and like what the real medical truth is, and then watching the episode afterward and seeing I'm looking forward to that.
I think
Nice.
that's reasonable. Well, the spoiler on episode 2 is that it did not get better. In fact, I think it was a little more ridiculous than the first one. We shall get to it. The first episode, we learned who everybody was. And so we start there with our, I don't want to call him a protagonist. It's just main
Hey,
character.
he's the hero, man.
he's just a antagonist.
He's a antagonist. He's not really an antagonist, but he's a antagonist. I like that. We start the best. This show does not disappoint when it comes to opening scenes so far, and so we start out with what I like to call the "Take Your Conrad to Work" day part of the show, where Dr. Conrad Hawkins, again, that's apparently his real name in the show. He is in front of I think high school classroom talking to kids.
Yeah.
And we have this scene is insane. And so what happens here?
So let's see. The teacher introduces him, says this is the doctor that diagnosed my heart condition and quote unquote, God willing, may have saved his life, setting up his faith, which is.
Well, I like the foreshadowing.
Yeah.
Which they don't wait very long to cash in on.
No. And so Conrad starts telling a story, which is straight out of, as you said, his medication school application essay. That alone is great. And then the teacher starts getting sick, which they do with a close up of sweat beading on his forehead, which is again, like accurate things just done all wrong. The teacher collapses, but it still has a pulse. So Conrad springs into action and asks the students for some tubing, a little cone, like a funnel, and a balloon. And he puts the balloon over the top of I was like, what are you going to do? I was like, is he going to pump I had no idea. I was like, I don't know what he's doing.
Wait, did this happen? Is this because I missed this part. Was this like a skip intro part?
Could have
if you
been.
hit skip intro that you might have missed it.
Oh,
Was it?
probably. Yeah. You probably did.
I was
because
wondering
it was
why he was so close to this guy later on.
yeah, you probably did. Yeah. So this is probably
This is the first time we meet that guy, though.
Yeah.
Mm-hmm.
So this is pre-intro. So yeah, I had no idea. I was like, is he making a beer bong? I don't know
That's what it
Yeah,
looks like.
tubing and a funnel.
device.
That's what I use that
Yep.
for.
This apparatus basically you take a funnel, puts a tube on it, and then he puts a rubber glove over the funnel. And I'm just like, okay. I mean, is he gonna like? It looks almost like a bag valve mask, kind of like. But this guy's awake, and so
Right.
no, he's doing this to MacGyver a stethoscope.
Oh my God.
Yeah,
Which
yeah.
also
Oh my
seemed to
God.
be it seemed to be the theme of the episode,
This is
right?
so stupid. Who cares? Oh yeah, the stethoscope got a lot of praise in this episode. It was like a
It
thing.
did.
Like people got
But-
stethoscope shamed if they
Well,
didn't
he
use it.
He MacGyvers the stethoscope to hear a friction rub.
Which
Now, okay, number one, no, he didn't. No, he
Mhm.
didn't through a piece of PVC tubing and a
Mhm.
funnel. But
So-
he does that because it's going to change his management on the what he's going to.
Well,
all right, a
should we
friction
tell
rub.
people? Yeah, what
Yeah,
a
we
friction
should
rub
probably-
Yeah,
is.
what's
how
You
about
wanna-
I was making guesses over here, but
All right, friction rub is a test question you get in medical school about the physical exam. No, so a friction rub is kind of something you're thinking when you think there's fluid around the heart. And so you hear the heart beating, but you hear this extra rubbing noise in there that shouldn't be there. And
It means inflammation is also present around the heart in this case.
I've had plenty of patients with effusions, that's the fluid around the heart. I don't think I've really ever heard a rub because you don't always hear a rub. And if you hear a rub in an emergent situation in a classroom where you have no other equipment, there's nothing you can do about it. What are you going? I guess he could needle the guy's chest, maybe. In
With
this
the-
universe, yes,
with the pen,
he would.
like
Yeah, I don't know.
like-
Like in this universe, he would probably try, but it's not gonna like if you see a guy like this teacher in this classroom collapse, you're gonna be like, oh, I'm going to do my ACLS. I'm gonna like make sure we have CPR if we need CPR. I'm gonna get like they said, I'm gonna get paramedics called and then whatever. I thought he
Yeah.
was going to open up an wall socket and start shocking him, and I was very
that would have
very
been cool.
impressed
Well,
that he
so
didn't.
but he doesn't do that. The guy does go unresponsive, right? So he's
Mhm.
checking his pulse, and then teacher's unresponsive, and we see. I loved it. Slow motion. He
mm,
raises up with his fist in the air and kaboom, slams the guy in the chest, and he wakes up with a gasp. This
Oh.
is a thing. It's still in the guidelines, so I got to give him at least the props. I mean, so
I've
that's
done it.
yeah,
once.
it's
I've
called a
mentioned it before.
precordial thump. And my father-in-law did it too. It's one of his favorite stories. So it does actually work right at the start if your heart goes into an irregular rhythm. The thought is that actually the physical compression will potentially shock it back into a normal rhythm, and you can get the opposite where you have an impact to the chest that'll put your heart in an irregular rhythm if you're really unlucky. So it's a real thing.
wow.
But then he also, then the paramedics are there within like 2 minutes at not even. I mean, I think and he's like, oh, this guy had a specific VTAC arrest, and
a
I'm like,
specific
dude, you
rhythm
don't,
arrest.
you don't know.
Yeah, I wrote Dr. Conrad can feel your QRS complexes through your skin, like because he's just a human EKG. No, you can't tell he had a VTAC arrest. You can guess, but you can't tell.
Yeah, you can assume it's either VTAC or VFib, but probably not VFib because he's still alive.
Right,
Is
exactly.
that and the V's and the tacs and the fibs?
Yep. So V is for ventricular, so the bottom part of the
Okay.
heart, and then tachycardia, fib, fibrillation. So the first, if it goes into a rhythm where the bottom part of the heart is going too fast and it won't maintain your blood pressure, that's what causes you to collapse. And when you in the early stages
That
of
would
a
be the
cardiac
ventricular
arrest,
tachycardia part.
you start out
Okay, this would
usually
be
in
the
the
VTAC,
tachycardia.
okay.
Yeah. And then that devolves into VFib, which is like if you look at it and the heart is a, I don't know, squeezy pump thing, it's just kind of going like it's not doing anything. It's just
Yeah,
kind of,
the fibrillating is like the appearance of like
Yeah.
quivering heart muscle. It's not really
Oh,
beating
gotcha.
or
It's not
moving
beating.
blood.
It's just fluttering,
Right.
kind of. Gotcha. Okay.
Yeah.
And those are the two rhythms that, the VTAC, if they're pulseless, and the VFib anytime, that's when you get the George Clooney paddles and you blast them.
Gotcha.
Yep.
Not the
Okay.
exact
Yep.
George Clooney paddles, but those are
Blast
shockable rhythms. And
Gotcha.
so,
Yeah. So like that
So-
part's great. The MacGyvering stuff that's just a waste of damn time. It doesn't tell. Yeah.
So what was he trying to do? Make an airway? No, stethoscope.
No, he
Yeah, so
wanted to hear the
stethoscope.
friction rub because the friction rub told him that his patient was like, you don't need that's,
Going
and he
into
would have already
detail,
known
yeah.
this guy has an enlarged heart if he diagnosed his heart condition. So
Exactly.
friction, yeah. Oh my God. Anyway,
Oh, it gets worse with the stethoscope.
yeah, no,
Absolutely.
it
It gets
does.
way worse.
Yeah,
later.
it does.
Oh,
So then
God.
we go to our credits, and then we change gears very quickly, and we're in the woods. And I wrote a
Oh.
joke before it happened, and then it was the joke. I think you guys probably did the same thing,
Yep.
didn't you?
Yep.
The second the scene opens up, you're like Dick Cheney.
I did. I wrote Dr. Bell. That's the evil surgeon from episode 1, and Dick Cheney are out for a hunt, and they're expositing. They're talking about like storyline stuff, and then the dude I called Dick Cheney shot somebody else, and I lost it. I just started laughing so hard because I wrote it before it happened, and then somebody yelled. All right, so what happens is all of a sudden somebody shoots somebody else in the butt. Is really kind of what generally happens, and then somebody yelled he had a heart attack, and I was like, okay, so basically the Dick Cheney dude started having a heart attack, which then he shot this dude in the ass. Yeah, that's like that. In my medical opinion, I'm not sure that he wasn't trying to hit that guy, because I mean, if you're having a heart attack and you're like, all right, I'm going to take this one final action, and I feel like he had something in for that guy.
Yeah,
So I'm
because
not,
you'd think you would pass out, you would lose all tone, not like I'm gonna pull it. Now, if you
Yep.
would have had a seizure, all right, maybe you would have shot that guy.
No, they were
Yeah.
like schmoozing, right? It was supposed to emphasize how Dr. Bell, and then this is a new doctor as well, right? It's Dr.
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 Hunter. They're
Dr.
out
Evil,
hunting, and it's Dr. Hunter.
So
Dr. Evil
yeah.
oncologist.
Right,
Yes.
right. So these two, and they're schmoozing obviously with these important people. No, he like shoots the bird, and he's like, oh, and then just like just pulls the trigger while the gun is down. I guess because he's a moron. I don't know.
I laughed so hard. I just laughed so hard for so long, and then had to stop. And yeah, so now we introduce a new character to the series, Dr. Hunter. At least it's played out as she will maybe be an evil oncologist. I don't know, not sure yet, but definitely leaning that way.
Well, she's
Dr.
in
Bell-
league with Dr. Bell, right? So-
Yeah, she's in league with Dr. Bell. So Dr. Bell is again
In
super
bed,
evil
probably,
surgeon.
with that,
Well,
you know.
there's a little hint at some of that, but we'll
Mhm.
we'll figure that out.
It's the curly hair.
And they're taking these dignitaries out, which the Dick Cheney guy, whose name I never actually wrote, I just call him Dick Cheney. So whenever I say Dick Cheney,
He's
it's
like
that guy.
a congressman, right? Yeah.
Yeah, he's a congressman of Congress things. And then there's
he's a politician too.
yeah,
I'm
and
in
who else was
Congress.
with them? It was a lobbyist. I think they said like just a lobbyist dude.
Of course, they're gonna put that in
Yep.
there.
And the congressman Dick Cheney shot the lobbyist. So that's
Wow.
that's where we
perfect.
start. We go over then we're there with Conrad and Nicolette, the nurse practitioner.
Can I just say one thing? That for the remainder of the reviews of these shows, I will not reference that guy by name because I refuse to remember his name. That's
Okay.
how much I hate him.
Which one? Which guy?
I'm going to
Which
say
guy?
the main character, and that means this Conrad guy
tagonist.
that you
Oh, okay.
spake of. The tagonist.
I keep having
Conrad.
a hard time remembering his name too.
You know,
I'm not
Conrad.
sure
The red-lipped tagonist.
why.
I didn't notice his lips being
You
especially
didn't?
red.
Oh my God. You won't be able to unsee it. And then you're like, what the heck? Is this guy drinking like Kool-Aid in between cuts?
I'm gonna have to look for that.
It is unsettlingly, his lips are unsettlingly red. Like redder than the nurse practitioner, nurse doctorate, whatever she is.
Nicolette.
Sally, would you say what her name
Sharon
is?
Carter.
Nicolette or Nick. They call her Nick.
All right.
Yeah,
So,
so
yeah.
they're talking on this. So this is a running theme. I don't know what these two are. I mean,
Well, I
know
think they
they're-
were a couple, and now they're not a couple anymore because
Probably
he did
because
something
he
bad.
had too much hubris.
Yeah,
Correct,
but
I think that's
she's
part of it.
so
Mhm.
right. So she calls him on the phone, and they're on the phone, and she says, "I have your heart." That's what she says.
Right.
That's like, and then he's like, "Oh, you always have my heart." And then what she means is your patient has a trance. Like that's not how you say that if you're not flirting. She's flirting.
Right.
Yeah.
Well,
Like,
she
come
says
on.
it though, like, "Hey, I have your heart." Like she found this patient's heart in like the employee fridge, like she was cleaning it
Yeah,
out.
and
Like,
the-
oh,
but
I
why is
found
she-
a heart for him.
No, she found it in that.
So then we go to the patient, Micah, and Micah is the teacher who collapsed in the beginning of the story. So Micah is in bed, and he's going to be told that he's getting a new heart.
Right. So
And-
it's the same guy from the first scene getting a heart transplant. Yeah.
Right. My
Okay.
favorite part of this scene was Nicolette saying, it's a long road to recovery, and she asks the patient, "Are you sure you're up for it?" Which seems weird because it implies that it implies he's just gonna be like, you know what? It does sound difficult. Never mind. I'm just gonna.
I don't want
No,
that
it's
hurt.
not.
Wait,
The
I'm
way
gonna have
she
to work
says it.
afterwards? No,
Yeah.
no. You just put it in and I'm fine.
Yeah.
Well, if he dies, then he becomes Formica.
It's a heart.
Mhm.
It's a Formica heart. That's
I also found it odd in this scene that like the second year internal medicine, which we find out Conrad Hawkins, Red Lips Hawkins, is a second year internal medicine resident. He's like the point guy for the cardiac transplant team now.
no.
It's because the person that wrote the show has no clue about anything
Right.
having to do with anything.
I mean,
Look.
what second year is like? Yeah, that it's not even. That's like
This person doesn't know what love is. This person doesn't know what
That's
Like-
medicine is. They've never
Well-
stepped foot in a hospital.
Did you guys with your residency? Did you ever have to like oversee transplant patients?
No, not once.
No,
you
they didn't let me
you
get
were
close.
kept away from them.
Right. Well, I was gonna say. So we were part of like at one rotation, we were like with the transplant patients, and if you were a transplant patient, we couldn't order them chapstick. Literally, could not give them chapstick without clearing it with the head of transplant surgery. Even if it was 4 a.m, that was made very clear to us. And so this guy is the medical resident being the go-to for this program
Mhm.
is so insane.
And this is ingrained in us, you guys. Like when we see a transplant patient, we're like, because they always come from a tertiary center, we feel compelled every time, no matter what, to reach out to them and just say, hey, this is what I saw. I'm going to send them home. They sprained their ankle. And they're like, thank you for the call. Yes, you can.
Yep.
But we won't do anything with them because it's like you could screw that up so easily.
Yeah.
Yep. And a lot of work went into it.
This dingbat is stroking this metal cage with a beating heart in it. A beating
We're not
heart.
there yet. We're not there yet. We gotta
Okay,
get there.
it's a beating heart.
No, wait. There's an ER scene though, guys. This is great. I love this.
Oh, there we go. Yeah. So
The whole
Rush-
troop
now
of
we're in the
hunters,
ER.
right?
Oh, this is one of my favorites. Yep.
go
Yeah.
ahead, Mike. What happens in the scene?
Okay, so yeah, they wheel both patients in, right? So there's the cardiac patient that they wheel in, and then they wheel in the gunshot victim, and somebody they roll him in. Somebody goes, Page Cardiology, and the guy's right there. He goes, I'm here. It was like, what the hell?
It's at that I laughed at that as well because as he literally like I'm right here, and okay, that's just
And
comic timing.
Then just doesn't do anything.
Well,
Ah.
and what I'm not clear about, like we saw this in episode 1, is this like an open ER? Like any doctor can just be the ER attending down here? Because
Yeah, where's
we
the
see
ER
internal
doctor?
medicine receiving patients, we see cardiology receiving patients, the surgeons receiving patients.
And this
Are
one,
there ER
nobody
doctors
received
in
them.
this? There's not
Nope.
one ER doctor
Nope.
here.
Nope. They're not there. This is a modern tertiary care hospital with no ER doctors.
Everybody
Yeah.
has every position, every job. It
Mhm.
sounds like
Yep.
every role.
Yep.
I enjoyed though in the scene that the Dr. Bell, the surgeon, is talking to the cardiologist about the guy who's had a heart attack, and so he says, "quote There were Q waves on the EKG, so he had a prior heart attack."
No. That's not what there were. There
No?
were U waves.
Did you say U waves?
They said U waves.
You're kidding. No.
no.
I might have missed that. Okay,
Yeah,
because
they
I was
said
going to
there
give
are
him credit.
U
So I was like,
waves.
okay,
Nope.
that's kind of
I
possible.
thought he said Q waves because
Really?
that's the
I
thing,
heard
like-
U waves.
they'll use the right, and then he's like, he had Rosk in the field, which is
Yep.
a thing. Return of spontaneous circulation.
And the cardiologist
Um,
said, we'll do an echocardiogram and do a cardiac catheterization on him. And I was like, those are all kind of words in the right order.
Yeah, no, but it sounds like a robot with a white coat walked up because nobody says that, right? And that's the
They
thing.
just
You have
probably
one-
did chat G or I guess
Yes.
that wasn't a thing there, but like Googled what would you do if, and then found.
I will do an echocardiogram and then a cardiac catheterization. And they're like, oh, thank you, doctor, for performing the cardiac catheterization on our patient.
I
It's
also
like,
appreciated that either way, the surgeon was like telling the cardiologist, there are these findings on the EKG, which means he had this. And it's like, well, number one, the cardiologist knows that. I don't know why you're telling him that. And number two, you're a surgeon. What are you doing with the EKG? Put it down.
yeah, you're going to go the other way. You want
I
me to
have
say is like,
right.
I will operate on this person if they get cleared.
I will.
by
I have
you.
never seen a surgeon tell a cardiologist anything about an EKG. I would love to see that someday. I would be very curious.
I'll put down the appendix if you
See.
put down the EKG. Let's just call it there.
Can I just say, like, at some point we go back and listen again just for the U-Wave thing? Because I'm fairly certain
Yeah,
they
we
said
can-
U-Waves.
we can try
You
to
guys, I
figure it
think,
out.
heard Q-Waves because you wanted to give them credit. But
You know
I
what?
think
Why
they
don't we see
absolutely
what I
said-
hear when I watch it?
Okay.
Q
Okay,
waves
yeah.
or U waves, and then
U-waves would be
maybe
really
it'll
good.
be a tie.
And then somehow Dr. Bell's prognosticating about the guy based on the Q waves. He's like, wow, I'm surprised he survived another one.
Yeah.
Be like, dude,
Those
that's not.
Q waves could have been there
that's
for
not
10
how-
years. You don't
Right.
know.
That's not how
Yeah.
that
And
works.
he's a cardiothoracic surgeon that also does general surgery.
No, he's just a surgeon.
Oh,
yeah, he
yeah.
does
He's the
all the
chief of
surgery. As
surgery,
far
but
as I
yeah,
know.
he
I
He
feel like
does all the surgery.
yeah, this person wrote archetypes. They wrote like
Yeah.
the bad boy. They wrote the surgeon without really understanding like everything is way more nuanced than that. And again, we're parsing a little bit, but the characters she wrote suck.
Yeah.
Well, it's-
Speaking of which, here come Conrad Hawkins and Pravesh, the intern. They come into the ER, and Pravesh takes this moment to let us know that he really wants to be an oncologist. Yeah, Pravesh sucks up to Dr. Hunter so quickly. And
Yeah, but here's the thing that bugged me about that. In every single one of these, it doesn't have to be medicine, but any scholarly movie, it's always like, oh, hey, Dr. So-and-so, I know all your work. I read your paper on blah, 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 and it changed my life. And he goes up there. He's like, I read your paper on blah, blah, blah. It was like,
noting your 5-year survival rate for this aggressive
it's
bladder
platinum-based
cancer.
chemotherapy for bladder cancer, which
That's what
Yeah.
he said. No, you didn't read that paper.
yeah, but like they always put that in there. Like that's the way, like I think people believe that we talk like that.
This is flirting in this world. Like in the fictional
yeah,
world.
he was
This passes for flirting.
is doctor hitting on her. Yeah, kind of.
Mhm.
He was kind of hitting on it. I mean, this was like really aggressive, trying to get the oncology. But I mean, the way that it kind of works in medicine is that, look, you start, Pravesh is an intern. He's a first-year resident. I'm guessing he's medicine since he's working with Conrad. So he might want to go into oncology. And you would want to say hello to the oncologist at the program and be like, I am interested in your field. You're not going to be this weird and creepy about it, probably. And I'm sure it does happen. But you're going to be like, I am interested. I just want you to know who I am. And you might take extra rotations in oncology. And you might, write papers. You might do some of that stuff. But you're not going to like, this is like, what, he's still like, I don't know if this is day 2 necessarily. But
And there's
this is
somebody
so
like,
quick.
who just had a heart attack, who's like in
Right
between
there.
you and this person that you're talking to. If I was that
Right.
attending, I'd be like, get out of my face. I'm busy right now. And noted, you're a weirdo.
Yep,
Yeah,
yep.
and she wouldn't fall for it because she would get, if she really, I mean, famous attendings are going to get, early interns and med students approaching them all the damn time, right? So yeah, she wouldn't fall for that
She's not going to be, no way. But then we
Well,
go over to
in the real
a
world.
buttock procedure in progress.
Yes,
The-
classic. This was great because the guy's shot in the butt.
Yep.
Woo!
The other more senior resident is there. So this is like the guy who's Conrad's colleague, and I don't know his name at this point. I did write it down later, but I already forgot. So it's just the
He's
other guy.
other part of the throuple.
Oh, it's an
between Conrad and
interesting,
Pravesh.
it's an interesting name.
Yeah, it was,
It's like Thatcher or something like
I
that.
scrolled out here. It was, I think, Elliot. I think it's Elliot. I have that down here. Let's call him Elliot.
But he
now.
actually looked
doesn't
like a resident. Like
He did,
you look
actually.
like normal people.
he did,
You know,
he did
like-
look like a normal guy. Well, he's okay. So he's hovering over the patient. This is a guy who got shot in the butt. And so he says, I got the patient sedated, and he's basically supposed to remove the shotgun pellets. So a few red flags here.
Mhm.
A patient that, I mean, you're not going to
So
sedate
bad.
somebody throwing them on their stomach with no monitoring equipment, which he had not. He had
Correct.
nothing.
There's a pulse
That's
ox. There's a pulse ox, wasn't there?
Oh yeah, because
Yeah,
he
but-
found later
Wow.
on it comes into play.
Right. So, okay, yeah, they had that. But there's nobody else in the room. Sedation is like one of the most, serious things we do in the emergency department. Like, it's a whole procedure. We have to bring
And
things to a
highly
stop.
regulated.
It's highly regulated. It's actually a high medical legal thing. Like, things can go wrong. And so the best part is, though, this guy took a bunch of birdshot, buckshot. They've said both words, I think, in the show, across the butt.
If it's buckshot, that guy's hips and pelvis and butthole are destroyed.
Yeah,
Right.
it's got to be.
Well, and let's assume it's birdshot, right? So it's just like,
birdshot.
they're
they're shooting
sitting there
birds.
going, well, yeah, that's true. That's true. You would annihilate them with buckshot. So they're supposed to, basically the whole thing is like, we're going to take the BBs out of the butt, right? Nobody wants to do this, which number one, no, because if you're a resident, you're like, oh, here's a menial task that'll take you like 3 hours and nobody will bother you. Like, oh, I'll do that all day. Absolutely.
Mhm.
But getting shot in the butt, they play it as a comedy beat, is horrible because
Mhm.
all the structures, especially your sphincter, your anus, if they get hit with bullets, that's like a colostomy bag. And so number one,
Yeah.
you're not going to do this without a surgeon blessing this patient and probably throwing them through a CAT scanner to see what kind of damage is done. There needs to be special like enemas and stuff. Like, I know, but this was silly.
Yeah,
This was
that's-
obviously just silly.
Yeah. Lose the movie trope, because everyone's like, you'd be like, hey, where would you want to get shot? Like you ask an ER doctor, they're going to have a very specific response, and it's never going to be the butt.
No, that's
It's never going to be the butt, because you
Oh,
think
wow.
like, oh, just go through your cheek, but it could hit your cheek, they go right through your and right out your. It could do any sort of number of terrible things to you.
Mhm. And it's
That
true.
does sound
Rip your
terrible.
urethra in half. Like it's, yeah. So,
Well, and the other part is you don't need to take out birdshot.
But you
There's-
can, like, if they're
you
superficial,
could.
the ones that they were getting, they were like sitting on the surface.
Well, right,
So
which
you
is
just, like,
that's
take a
exactly
rag
what
and-
what birdshot does. It just sits on the surface of the skin. I mean, no, it's going to go in. I mean, it. But you
At that distance, though, it would go in, but probably not that far. And at that distance, it probably isn't a fatal shot. And at that distance, it probably won't cause any problems from what they showed on the show.
right. So maybe, but still, you wouldn't have to dig them out.
You wouldn't
I mean,
sedate them. You wouldn't sedate them to dig. You're not digging. You're not cutting. You're just
No.
scraping.
30 of these out. You
Is
might-
this a
Right, yeah.
situation where it would make more sense to just leave them in there and let it heal?
You
They
leave
would
the deep ones.
If they
yeah.
really wanted to take all these out, they would take them to the OR. Is what they would want. Which because you can't do this much local anesthetic and this much flesh. Like it's going to start to become a problem. But
I suppose the argument
digress.
would be you're going to be sitting on them, so they might be painful if there's
Yeah,
no
it's
damage
true.
to internal
Mhm.
structures. I mean, Greg LeMond won the Tour de France in the 90s with something like 60, 70 pieces of birdshot still on his body.
Really?
So like, but it was side into the
Mm.
legs. So,
Mm.
you know, I mean, you just leave it in place if it's not in this. And they had the metal dish that they were dropping the BBs into, which is just
Satisfying.
Classic.
you just
Yeah.
you don't ever hardly ever need to do that. You deal with the damage of the
But
bullet.
if you do these things, you need a metal dish.
you do absolutely do. Yep.
Yeah. I know a plastic surgeon who would say that. You need a metal dish.
You do. You have to have a.
I
metal
had
dish?
a
have to have
surgeon,
metal
so I
dish.
did a bulletectomy in training in like medical school, and the surgeon was like, "Wait, don't." I was like, "What? I just put it in the cup." He's like, "Nope, wait." And he went and got a metal dish. He's like,
You know
"Here."
what's nuts is I will never know if y'all are being serious.
That is
No,
absolutely
it's
true.
absolutely
100%
true. Yeah. It's just like a weird thing. You could put in a plastic cup, but it's just like
if you pull it out,
because of the movies.
Yeah.
You got to
yeah.
Oh, okay, gotcha. So it is as a side kind of like.
But yeah, the guy would be totally awake though. He wouldn't
We
be
get
sedated.
really hung
Totally
up on
awake.
weird stuff as doctors in this show. This is funny.
Mhm.
I just like the bird shot.
fair enough.
Get the bird shot. Profession, the other Elliot, the normal dude resident, are like they're trying. The whole gimmick is like nobody wants to pull this stuff out. So Profesh puts on his gloves. He's about to do it, and what do you know? We find out that Micah's heart is arriving sooner than expected. So Conrad needs Pravesh to leave the room and help him with something. And what that really means is that he's going to totally neglect, he being Conrad, is going to totally neglect all of his patient duties and supervisory duties so he can go hang out for this heart transplant. And he tells Pravesh, "You're on your own for Independence Day." Would you say that this was a good handoff?
No. So
no,
yeah,
not
so
at all.
it goes to a scene with it's a comic. It's a weird, crazy. It's like it could be in a musical. I don't get it. So Pravesh goes to this room, and there are like 15 or 20 more residents waiting to give him sign out individually.
But
about
why? So, like before that, though, what is the speech
Oh.
that they have?
the
That's what I-
speech.
oh
Yeah.
my gosh! So Conrad's like,
Yeah, he says you can't bother me. You can't page me.
Yeah,
Right.
essentially, don't reach out.
paging me as your supervising resident is a sign of weakness. Go take sign out from 30 different interns right now. What do you mean you don't know what sign out is? You'll figure it out. And then, yeah, that would be, that is insane. There's
Reckless
like,
endangerment.
Yeah.
yes. This
Okay.
hospital has to spend as much on medical legal defense as it does on heart players in its lobby.
But then
It's crazy.
you're right, Aaron. Though it did play like, when you're a jet for life. Like all these people are like trying to come up and get signed up, but they're each signing out one patient, and they're each signing out one very simple and uncomplicated patient. Like one person had low blood sugars. Okay,
Yeah.
like not
And
a
they
big deal. And these
They made
people
it
would
sound
take
like
sign
all
out.
complicated. They're like, oh, this patient has pancreatitis from, and then they kept going. They're like, it's from this and that. And they had to like, doesn't matter. Pancreatitis. That's it.
Yeah, right. It's
So-
essentially in a sign out. It's kind of like what are the pending tests? What do I need to follow up on? And that's it.
He's like,
It's
he's
bare
in the
bones
middle of the
minimum.
room. And it looks like, you said musical. I was like, this looks like a trading pit at the New York Stock Exchange. There's like a bunch of residents waving papers at him. He's in the center. And then he's just like, you know, this lady has diabetes. My lady has CHF. This lady, don't let her family come. It is pretty hilarious. And it's also like, we know sign out is like one of the most dangerous things in medicine, because if you don't pay attention, you miss stuff. So we take it really seriously. And this show wasn't from like 1974.
Yeah.
Was
I don't know. I mean,
they have a computer, they have a medical record, right? Because people walk around with iPads on their hands, and then they're going to have handwritten notes for things.
Yep.
Like these things, even when I was in training, which was in like the early 2000s, everything was on a Word document. You filled out everything on the computer. You printed up a sheet and gave it to the person that was taking sign out.
Yeah.
And then you left your pager number. If you have any questions, give me a call.
Yep.
Yeah. Well, and one of the duties, like, so each team had a common, I don't know if it was Word or Excel, but you had a spreadsheet.
Mm-hmm.
And one of your duties at the end of your shift or sometime in the shift is to update the whole entire sheet.
Update the list.
And then you print a new one when you do sign out, and then you use the list for the sign out. I mean, there was very clear information about what was going on and what the results were. It's
again,
not
any person that had done any residency ever, no matter what it is, maybe except for dermatology, PM&R, but they would have done an intern year.
Yeah, they would have done an intern year.
And I did have lists of 20, 30 patients to cover. It was overwhelming feeling.
But any consultant that may work on this show would know, like, this, even if it's dramatized, is dumb.
It
does nothing.
Level.
Yeah. And maybe what they're trying to explain is like the chaotic environment that this guy has to function in. But it's still like it falls short.
But I mean,
everything in this show does.
You could, if you have him called to the bedside of a patient and you're pulling out an Excel list and flipping through the pages to get to that patient, that's still like plenty dramatic and stressful.
Yeah,
you know,
right.
and you could do it a lot of different ways.
Yeah, there's plenty of ways to capture the drama without being like campy and oversimplifying.
It was like Sam Raimi did that scene.
Yeah,
which
that
is
pretty fair,
flying in and like throwing a sign out at you.
And he was punching himself in the face, and then
all right, so we're approaching the heart transplant now. So Dr. Okafor, who's a second year, she was the one in episode 1 who was like the best surgeon in the hospital.
Heartless.
The second year resident. Yeah, she is ironically here heartless because of her lack of tact. She's in the elevator with Conrad, and they're talking about like, oh, this is going to be a cool case. And it turns out the second year resident surgeon is going to be scrubbing in on the cardiac transplant case because she, quote, beat out all the other residents. And based on the accuracy of this show, I can only picture that she did so in like an American Gladiator style jousting match because number one, no, you're not doing a cardiac transplant case until you're a 20-year resident. Like it's just not, there's no way a second year resident is going to be like doing that. There's just no way unless you're just sitting as a fly on the wall. I mean, if you out there are a surgical resident and you did this, tell me, maybe I'm wrong, but this is insane. But it sets up.
Gonna say, I hope they did the stick fight on the pedestals with the
yeah.
That was my favorite.
I want to shoot the tennis ball gun. That's what I really want.
Oh, that was a good one. There's a great documentary. Actually, it's hilarious. Anyway,
oh, and then here's your moment, Mike.
This is where we have the cut where it's like a darkened room, and he walks in like because he's getting ready to help Micah get his transplanted heart somehow.
Mm-hmm.
I don't know. And there's this shot of Hawkins like putting his hands on the outside of this like capsule looking thing that's got
that's the heart
beating heart inside of it.
Beating it. That's the Tony Stark beating heart.
Yeah.
Yep. Dr. Conrad Hawkins has to have a nice touching moment with the heart. And I'm like, don't touch the heart, dude. Like, but she doesn't. It's behind plexiglass.
Why is it beating? Why is it beating?
Does that have, so first off, I was
curious, how does it, I mean, I'm sure I'm taking all my best logical guesses here that it doesn't show up actually beating. Like, so how does it work? Where does it, how does that happen?
They don't let emergency residents into cardiac transplant cases.
So there could be some sort of a pump that I'm not aware of.
Mm-hmm.
I remember they were working on one. I gotta be honest with you, I don't know if they developed one, but definitely not like this. You would not leave the heart unattended in a storeroom where like
somebody's got it in their hand running it. running
Pretty
it to the
quickly
patient.
from-
Yeah, it
once
comes out
it's-
and it goes in as fast as
Yeah.
possible. And again, the
Right.
time, maybe somebody could say like, hey, this is how long you have. But
I didn't actually look up, but I know they were working on a device that would keep the heart, basically nutrients and keep it alive because you want
I
to.
think
Yeah,
I've seen that.
yeah, and I don't know how far along that is. So again,
it was just the dumbest. And can I just tell you that he looked like an idiot with his scrub cap on because he didn't fold the edge over. You fold the edge over. Am I right? You
Yes.
have
the edge
one
over.
way.
Yep.
So if
Yeah,
you want
no,
to be
you
like
fold.
in Catch Me If You Can or whatever, if you want to identify that you have never been in an operating room,
Mhm.
don't fold the edge of your scrub cap over. You're either anesthesia or you're not a surgeon. And an old anesthesiologist, because they're
Scrub
just too
cap is the
long.
thing
You
on your
fold it
hat?
over about an inch. Yeah.
You just
Oh.
fold it over so it fits tighter.
So he had
Yeah,
his
that's
down
right.
all the way down. He looked like a moron. I hate that guy.
They're treating their scrub caps like you
You got to cover the eyebrow hair. Yeah.
Yeah, it's
Nope.
great.
So now we're back to the congressman, Dick Cheney guy, who is waking up with Dr. Bell and Dr. Hunter at his bedside. And he asks, is Mitch okay? That was the guy he shot, apparently. And it's like, yeah, I'm not convinced he wasn't just trying to kill Mitch. And like, this is still all part of a big ploy where he's trying to play it off. And the cardiologist comes in. He's super aggressive with his care. He's like, this man, speaking of the congressman who had the heart attack and then shot the guy, he's like, this man, he goes from he needs an echo to like he needs a heart transplant like today.
Yeah, right. Yeah, right. So, like, give it a couple days, man. Maybe that
Oh.
EF is good. But he did say like, his ejection fraction is really low.
Then that was right. I mean, that was a right
Didn't
thing
say
you would
anything.
say.
Did he say anything about his cath?
No, he
I
didn't.
I don't think he said
don't
anything
think he
about
did
it.
it. Did they not even do? They just did the echo. I don't know.
And then realized, like, oh shoot, I've got to do a transplant.
You might imagine there are a lot of steps in between. Your heart is damaged, and we need to get you a new one. There's a lot of steps that prove that you've gotten to that point. And I know there are the super famous among us who seem to get organs at a high rate, but like Dr. Bell, the evil surgeon guy, is there in the scene. And he like goes full Walter Sobchak with this. He's like, you need a heart? I can get you a heart. Get your heart. There are ways, dude. And he
At
basically
the
but what about,
bedside, he
like,
says this.
the cardiologist. Yeah, I mean, he's just like, we need a heart. We'll get a heart. We'll get a heart for the congressman. Why not?
Like, shut up. This is not. This
I
that
got a
doesn't
heart
work.
in a closet for you. I'll
It doesn't-
find
I
it.
know, right?
Don't worry.
Yeah, it's just so comically evil. It doesn't work this way.
And Micah, our
Um,
teacher from the beginning, is rolling into surgery and finds out that surgery's been canceled. And so
No.
Conrad is angry.
He
Yep.
is angry. The antagonist is angry.
But wait,
He's
but
on
why
the
does
trail.
Micah need one? He needs one because he had a friction rub and a U wave on his EKG.
Well, yeah. the
So he had
implication.
pericarditis. He had pericarditis, and they're going to transplant his heart rather than just giving him ibuprofen. They're going to give him a heart transplant.
The implication is that Micah has some congenital heart disease of some sort. Like his heart
And
was
then-
formed irregularly, and that I think they mentioned earlier that Conrad heard a murmur or some BS that.
Okay, yeah, but like, AICD, right?
well, yeah,
Well,
no, you're
sure,
right.
There's going to be steps. Yeah.
Because he had the arrest, I think they're saying like, oh, he's at the critical point. It's not really how it would, but you could have an arrest. I'm not saying you couldn't with a congenital heart defect, but yeah, people who are getting heart transplants have exhausted all medical therapies, and their heart is just it's fledgling. It won't work without a transplant, and so yeah, it's a little quick on both courses. It's not quite Dick Cheney character quick, but.
All right. So they canceled Micah's surgery to give the heart to the congressman because Dr. Bell is evil. That's where we are.
Yeah.
Right? Yeah. Right. And then they reallocated the heart. And
As
So
they
then-
said.
yeah, then there's a great scene where doesn't Conrad like run? They're outside and he like runs to catch up with Dr. Bell and just sort of
Yes.
knows where he is to confront him
Mhm.
about this.
Which
How does
we've
he
seen
find him
Dr.
all the time?
Conrad confront Dr. Bell so much angrier over less than this. I thought he was a little subdued. I'm just going to say, like, Conrad was not super turbo Conrad in this scene, but he's like, he comes up and he's like,
It's only episode 2, man.
it is true. But, he's saying, hey, look, this Micah is a school teacher. He's got a young family. He's a young guy. And you gave that heart to the, to Dick Cheney and
The old
It was-
smoker, which
old smoker. Yeah. Which they throw in there, of course.
so yeah, this is right. So I mean, yeah, you can't. I think that organ allocation is so complicated and it's such an ethical thicket. You can't, like, there's a lot of
Right.
dangerous thinking on display
Yeah.
here, I thought. I mean, that's why there's such a huge process and all these checks and balances. You don't just like go back and forth. And then you certainly don't make emotion based arguments framing a person as more morally receptive of a heart than another.
Right.
And so, like, for example, if you have somebody who's a hardcore alcoholic, that would potentially, derail them from getting a liver transplant, in my limited understanding. Right. So there are some things that are medical diagnoses that might affect that we would regard.
But if they
that's a
demonstrate a
medical
pattern
decision,
of
though.
stopping,
Exactly.
you entertain it. You definitely
Right.
entertain it.
And so that's like a medical decision. Like the fact whether this guy's a smoker or not, or older, like you don't just say this guy's a jerky smoker guy and this guy is a young, like, very charming gentleman with a nice family. And
but he is a
prays to
charming
God.
gentleman.
He is, right? But that,
I mean, yeah. Well, and the other, so there's like a couple things. Like, I think the writer, that is the bent here. And look, hey, the higher echelons of society seem to get organs quicker. I don't know that that's the case, but I think that's what the writer is saying here. I think that's what
right. So
what
the
that part
general concept that an unknown young African American man is less likely to get a transplant than an old rich congressman. Like,
yeah, I think
that feels accurate in our system, but it's not, because these two guys are having there's definite health disparities, but it has to do with access and workup and so forth. I mean, that's not.
Bell doesn't get to decide who gets the heart. Bell is absolutely out of the equation. One, he's not a transplant surgeon, so he wouldn't say anything about it. And two, he doesn't get to decide.
That is
Yeah,
true.
it's much
no
more
panel.
complicated than just someone saying like, "Oh, smoker, no; teacher, yes." Like,
Yeah.
Right.
that's-
Albert, you're probably
that's not how
in
it happens. It's
even
super
way more of
complex.
these discussions, I would think, right? I mean, you're probably in these discussions more than we are.
Ethical discussions around like medical decision making. Yeah. And honestly, it seems like all of these, there are the ways that things are supposed to work and then the ways that things often do work. But in reality, it's just way more complicated than could be captured in a moment on screen of like, and it's way more complicated than saying, yeah, this person's a smoker, so no.
Which, I'm curious, with your expertise, Alba, who would you give this heart to?
Tony Stark.
Nice. Yes.
It's
He'll
in
save
his
the universe.
box.
All right, so then Conrad, now we have him storming up to Pravesh, his intern, and he tells him, he's all mad. I understand, I'd be mad too. But he's like, all right, call the organ procurement people every 15 minutes to see if they have a heart. Which that's also not, I think, how it works. You don't just like call them. It's like when I called Blockbuster and they had Goldeneye, because it just came out and nobody had a copy of it. And so I'm like, did you get a copy in? No. Do you hold it? No. So I called them every 15 minutes until a copy came in.
They
and
hated
it actually
you so much.
worked for me. They definitely hated me. I actually got a job there later in life. True story. But they definitely hated me for doing that. But that's not how you get a new heart. You don't just like call the organ people. Like, did the heart come in yet? Oh, let me check in the back. No, we don't have one.
Yeah.
Like, so
We got a couple of corneas and some toenails.
Yeah.
Well, that'll do. Send them over.
So yes, Conrad's checking in on Pravesh, who's on his Independence Day and seeing all these patients. And he's trying to discharge a patient. And he says, you're going to go home soon because your EKG looks good. And then Nicolette is like, you suck. And
You
she
need to go
says,
back and
"You
listen to
can't-
his chest.
Yeah,
Mike,
you
take us
can't."
to the
Yep.
scene through your eyes.
It's the same thing, right? Like it's the same thing. And so like this horrifically terrible writer writes this episode, this scene.
I mean, I'm sure there are other
So it's
writers
essentially
too, but
rounds.
yeah.
Well, they are all collectively horrific. So they write the scene about this guy going in and he's doing his doctorly thing, and it seems like he's got a decent rapport with this person. Like, hey, we're going to discharge you. We've already done all the tests, right? And then this like smug then is like, but it's not defined, is it? It's never
in the
defined.
first
It says
episode
she's
they
going-
do.
Yeah, she's a nurse practitioner.
No, in this episode they say she's studying for her doctorate.
Yeah, doctorate of nurse practitioner.
Well, you get a
Let's-
pay raise, don't you? If you go from an NP to a DNP.
I think it's just written into the program. It's just like
do you think that they were like implying that she's going to medical school
that
now?
she's that she's going to get her doctorate as a nurse practitioner,
Right,
like
which is a
essentially
thing.
getting her degree as a nurse practitioner. So I don't know that she's
Oh,
a
like she's
nurse
still a
practitioner
learner.
yet, because why would she be sitting? Yeah, why would she be sitting at like all these secretary
Ooh,
desks?
I don't know.
and,
It's
like,
yeah, good point. I have no idea. But anyway,
but
so
anyway, so yeah,
I don't
she
think the
tells him
writers
like,
have any idea either. So.
yeah,
fair.
you've got to listen to his heart because you could, miss things potentially. This guy has been in the hospital and has had a cardiac evaluation, and he's just going in there to make sure he's doing okay and sending him home. And if somebody told me to go back in the room, I'd be like, man, especially if they said it in front of the patient, big go pound sand, man. Like, what the hell? So he goes back in, he listens with a stethoscope. He's like, oh, everything's fine. But then he remembers this for later on.
no, he storms out of the room and he's like, he has a murmur. And so he's super
Yeah.
mad because he says, quote, why didn't the murmur show up on his EKG, end quote. And now I'm really worried about Dr. Pravesh's clinical acumen because you hear murmurs, but you don't see murmurs on EKGs. I think he's a really bad doctor now.
Yeah.
But
When you
her
go to
point
Harvard-
in doing that was
Yeah,
like, oh,
yeah.
you got to listen to the chest, and he's like, why didn't the murmur show up? He's like, okay, I don't know, but you did echoes, you did all these other
Wait,
things.
when he said that, did she just walk into a wall over and over again?
I don't know. But I'm sure they imply that he had this big cardiac workup. So like, he might have had a murmur the whole time. Like he had echoes. He would have seen certain things. And I'm not saying that things can definitely develop. It absolutely can. But we don't know enough about why he's there as to whether this murmur would matter. And
So you're telling
Again.
me this guy, after his cardiac evaluation, has a massive MI that ruptures one of his papillary muscles. Then he develops this murmur, but never has chest pain and never describes it to anybody.
he's just chilling there in
along
bed.
the way.
Like, thank you, doctor.
And he's there and all the visitors have their lanyards, like visitor lanyard. So like now, and then the wife isn't going to say like, well, honey, you've been complaining about crushing chest pain for the past 4 hours and you didn't say anything to anybody. It's like, oh, don't worry about it. I'm fine. I'm just going to go home. I'll get a heart transplant next week.
That'll be it.
I did
Dr. Bell,
like,
give me one.
I really like, I formed, of all the characters in this show, the one I like the most is a diabetic dude.
Yeah, the
Dude
guy
who
who
comes
always
out
wants to eat.
With he always wants to eat and his foot is dying. Like he's a complete stereotypical one-dimensional character, and that's like egregious, but he's kind of endearing, and I'm really hoping that he has a rewarding character arc.
I'm hoping that he never shows up again because the actor that plays him is actually a terrible actor. Like he's just unbelievable. He's just like
Well, yeah.
be like the Big Lebowski, but not good at acting. Just look like him. Like okay, I could
probably
do
true.
that. One-legged Big Lebowski.
But we go from that comedy beat where he walks up. What did Aaron, you wrote it? 5 cups of chocolate pudding ought to slay the beast because he's about to
Yeah.
have his
Yeah.
foot amputated. And okay, fine. So we get a comedy beat that then flies into an emergency because now we're emergency in the telemetry unit. And
Which is funny because
I must have walked away like
did
none
you
of this
not
is
see
ringing
the
a
scene,
bell.
Mike? Because this scene
Oh,
has
this
you
is
written
so
all
great,
over it.
yeah.
That might be better that you didn't see this
Emergency
scene.
in the what unit?
Telemetry, so the watching the heart on the monitor unit. So certain
Yeah.
beds in a hospital.
somebody's heart is spiking. No, his
No.
heart rate is spiking. so Pravesh like gets the crash cart just in case and like runs over and they're all
I
running
did see
over
the end of
because the
this
guy
scene.
had a rapid heart rate. But okay, so his heart rate went up.
How fast was it?
I don't know.
Could you see on the
I
monitor?
didn't
'Cause
see. Yeah,
I
don't
glanced
remember.
up there and it looked like it was probably like 150s.
Not fast enough to worry about it too much. Yeah. And then and it cuts to the picture of this guy like looking all sheepish and he like throws his phone behind his pillow. And then Nicolette just magically reaches behind his pillow and pulls his cell phone out. Oh no, it falls out on the floor when she tries to listen to his lungs. And the guy's like just watching nurse porn in his room. So
but like,
But the way she
comical
handles
nurse
it too, she's like, yeah, like naughty nurses. Wah, 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 and then walks out of the room. It's
no,
like,
she says get the mitts.
wait.
She says get the mitts. That's what she literally says when she says
oh yeah,
So this guy is masturbating in the hospital, and they're gonna put him in 4-point restraint so he can't touch his genitals.
yeah.
Get the mitts?
Yeah.
Yeah,
Oh,
that's what
I
she
was
says,
like,
get
what
the
is he
mitts.
saying? Get the mitts.
yeah,
What
like
does
the
that
restraint.
mean?
So
Oh
those
my
are
God.
restraint mittens so that you can't like grab anything.
But there's
And
no
then
backstory. Is this guy like a chronic?
No, he's just a random dude. This is just a comedy beat for its own sake.
for laughs, and then you cut to him literally restrained to a chair in the middle of the nursing unit, and the nurses are watching his porn on his phone and making fun of him.
Look, I'm
And
going to say
the
of
guy's
all,
like looking all sad.
well, of all the
Oh my God.
inaccuracies and horrible moments in this show, I'm not I'm not saying that many of the ER nurses we've worked with would do the restraining the patient bit at the desk, right? But criticizing his porn choices, I can kind of see. Because
Well,
they're literally
yeah,
making
well,
fun of his
again,
porn.
There'd be a
would
hard
do that.
correction, like in anywhere. There'd be a hard correction, like, "Hey, you can't do that. This is a hospital. This is
it's also making a
just, like,
joke out of like assault. So nurses and techs get assaulted in the ER. Any other
Yeah.
place you would call it assault,
mhm.
right? So
But
so
then
patients
they assaulted
will-
him too. Like they took away his
Yes.
rights just because he was.
right.
So
So
how about this? Use your words. Don't masturbate and look at porn in the hospital. Okay, sorry, I won't.
Done.
I mean, that's that exactly.
Yeah.
They'd be like, that's not
The
appropriate.
scene is not that
Yeah.
funny. It wasn't funny at
I'm
all.
just
It was
really
like,
proud of Mike's very mature reaction to this scene.
it just wasn't. It was
It
like
wasn't funny.
No,
there was
it wasn't
nothing funny
at
about
all.
it.
It was bad. Like the rest of the show.
And I think it's because like when we do restraints on people, it's a huge deal. This is a government regulated
Oh yeah, absolutely.
thing.
Absolutely.
Like
yeah,
I have to put it
being
in order.
restrained is a huge deal.
And
That's-
if you're in this normal guy, right? It's not like he's attacking people. Like seemingly otherwise normal guy
Yeah.
who's doing this, you use your words to correct him. You can't take his phone either. That's theft, right?
Yeah, technically
Like,
true. Yeah.
The
no,
whole
understand.
these guys are so stupid.
Well, speaking of stupid, the next scene was probably this may be one of the dumbest scenes in the show. We go back to the dude's butt. They're still taking out Birdshot. Pravesh and the other resident guy, again, I think his name's
Oh,
Elliot.
God,
They're
yeah.
removing BBs, and the man starts coughing.
Mhm.
The way that this
Like a little cough. Like,
He's like, how long has he been doing that? Okay, so we are led to believe
Oh, it's so good.
at this moment, Pravesh looks up and he's like, patient's heart rate has increased to like 106 beats per minute, which is not super fast, but fast enough for this diagnosis that we're going to find, sure. But he's like, how long has he been coughing like that? How long has his heart rate been up like that? His pulse ox is low. And no, it wasn't. It was low normal, but it was still normal.
It was
technically.
93.
So, okay, whatever.
And he's
like,
laying on his stomach and he's a bigger guy, so it's gonna be 93.
yeah. And so he's laying down. And so Pravesh listens to his
Ugh.
lungs.
with his stethoscope because he's been
Because
shamed.
of Nick earlier today. Yeah.
So he listens to the patient's chest and he says, oh my God, this guy has been immobile. He has a pulmonary embolus. Now, it's a
He's
very
been
real
immobile
thing.
for like an hour and a half.
3 hours. Yeah. He said a couple hours.
3 hours max. Mhm. Has he never slept? Yeah, right. I wrote that down. I was like, you gotta be kidding me. Like they won't even open a book. So then, yeah, he's got an abnormal lung exam. He just says he's got an abnormal lung exam. It must be a PE.
Which is
and
the opposite.
So the problem is
Alba, do you know what that is?
a pulmonary embolus.
embolism.
Right. But describe what it is.
Me?
Or Alba, sure.
That's when a blood clot forms. I think if I know this one, correct
go
me if
for it.
I'm wrong. A blood clot forms somewhere and where it cuts off blood flow to the lungs.
Yeah,
Mhm.
that's exactly
Yep.
what happens.
Mhm.
It's a risk with surgery or prolonged immobility, not 2 hours to 3 hours immobility, but you have a surgical procedure where you're completely immobile and possibly a risk with anesthetic, not entirely sure. You can get a clot that develops in your leg, typically is the most common spot, and then it will then break off from the vein in your leg and it goes up into your lungs and it can block your complete blood flow to your lungs. It can be immediately deadly. It can be very painful and not immediately deadly. It's a lot of different things. But you know, one thing you can't do with a PE, you can't hear it.
Yeah. So that I was just gonna say the lack of other findings to explain the things that you're seeing would mean that it's probably a PE. So if he's coughing, it's probably not a PE. If he's got an abnormal lung exam, it's probably not 100%, but it's probably not a PE. Now, the thing that they missed that they could have gotten would be a bullet embolism.
That's what I was going to say.
So like you get hit in the back of the leg, there's a chance you could have gotten a venous BB that then traveled to the heart. It
Yep.
acted like a PE.
Especially with birdshot. You have a bunch of them
But they
scattered.
missed the boat, man, because they're dumb.
Oh, damn.
This is where I wrote, I was like, I cannot believe this is a P. This
That would've
makes
been
no
really
sense.
cool.
And I stopped and I was like, oh, if it was a piece of shot that went in, it's like, are they that clever? No, they're not that clever. 'Cause
They're
that's
not that
what
clever.
happened.
Yeah, because he just yells out massive lung clot.
Well, it will. Yeah, we'll move to diagnosing later because that's even.
No,
Oh,
this is
God.
before the diagnosis. Like
Yep.
he's decided he needs to rush him off to CT. He goes massive lung clot.
Yeah.
I mean, yeah, it's like kind of, but no, none of this makes any sense.
So they get the right diagnostic test though. Good
they
for
did.
them.
They did. I was going to say credit where it's due. They had to take him to CT. That is correct. That's what you would likely do here.
Hmm.
So now we go to the next place, and Micah is surrounded by some people. It sounds like it's like a church group, and they're praying for him because he's not going to get the heart. And we have Conrad and Nicolette peering at him through the blinds. And by the way, do you guys ever peer creepily at patients through blinds? Is that a thing?
Only if it's like a really agitated or drunk person. Then
If
I
I
want to
don't-
make
if
sure
I don't
there's
wanna
left,
go in the
I'll just
room.
like peer in.
Okay,
Just like
fair.
I discharged them. I need to get out. They're unsafe. Like I'm gonna peer.
Yeah, fair enough. But this
But
is
not through partially open blinds.
This is just there to say, basically, Conrad doesn't want to. He doesn't, none of us would want to tell bad news or that sort of thing, and so he's trying not to. He's saying like, I hate telling him this part, or I'm going to discharge him home because we don't have a heart for him. That's basically what he's going to go tell him.
But actually, probably the right plan. Let's revisit things in a couple weeks.
This guy's been discharged. I think they said 3 times
this
from the
guy's the-
hospital.
Wait, how do they say that?
They said it at some point.
I think it's during this conversation because he's like, "Do I have to tell him?" No, this is like this. The Nicolette and Conrad are talking in the hallway, having like a moment,
Right,
And
they're
they hold
talking about
hands. So
Micah out of
and
earshot.
she kisses his hand, and then he says, "Do I have to tell them?" And it's all touching. That's the
Yeah,
scene.
but then it's like
maybe you blocked it
he's
out.
in and out of the hospital, but it makes it feel like this is all happening on the same day.
Well, but I think
Oh, right,
this
no,
is.
yeah.
Oh, yeah, I see what you mean.
But maybe he's
'Cause-
been in and out of the hospital trying to get the heart.
Yeah, where they said come in and then it didn't work. That does happen. Yeah,
Yeah,
because you have to get if you're going to be like you have to go to the operating room and get prepped or something, and then like to be ready for this rapid change, and then sometimes something falls through. So
Unless
Yeah.
you've
Or
got
it's
a
not
box that
viable
can keep
or-
the heart beating
Right.
outside of the operating room.
Yeah, unless you're Tony Stark.
Yeah.
so
or Davy Jones from Pirates of the Caribbean.
Well, now we end up in the CT scanner. They're diagnosing the patient with the pulmonary embolus, and the patient crashes right there in the CT table. Which honestly, that does happen, unfortunately.
Actually, yep. I was like, accurate.
Yep, that part was like,
Yeah.
that.
yeah, but they have Pravesh like showing his chops by looking at the big screen and saying,
No,
"Look,
that CT
big
tech
blood
would have
clot.
been like, back off, intern. Like, do not touch my stuff. Like, let me get the images. Go look at it with the radiologist. But
yeah, no."
how bold.
Well, that wasn't even a CT tech because that guy later offers to do so that's a radiologist sitting there.
That's the radiologist.
Oh.
That's so the intern is telling the radiologist what the scans.
Oh,
No,
good
you're
job.
not.
He was about to say it, and then Pravesh is like, "Oh, it's a blood clot." He's like, "Yeah, nice job, guy.
Good job,
That's
intern.
great."
Pat on head.
Lung clot.
Yeah,
That's when he said it's a massive lung clot.
Yeah,
But they see the guy says there's a filling defect in the right pulmonary artery, and the guy goes, "It's a massive lung clot," but it's not a massive lung clot. He didn't say it's a saddle embolism. He said
Right.
there's a filling defect. There's a small right lower lobe pulmonary embolism, and so then he said you need to give him IV direct thrombin inhibitors.
yeah.
Yes.
So
That's what he
There's
says.
just a whole. They put a bunch of words that might sort of. Well, not really. So first off,
No,
they go to the CT scanner. People do 100% crash in the scanner, so they like read
Mhm.
that happens, and they do crash from PEs of variable sizes.
When
So-
we highly suspect there's a PE, we worry, and sometimes we even hover. I have hovered outside a CT scanner in case.
Yeah. And so there is a clot. And now the patient, they do list a blood pressure that's a shock blood pressure 70/30. So like this patient does have what's called a massive PE. So they need something done right away. Yeah. And the guy's like this, the radiologist is right there. Right. And he's like, well, do you want me to do a thrombolysis?
Thrombolysis. That's not how you
It's
say
not-
it.
that's not how you say it.
thrombolysis.
Okay, I was like, that doesn't sound like a word.
No,
Right.
it's thrombolysis.
Now,
So he basically the radiologist at the bedside says I can just do a minimally invasive femoral catheter thrombolysis, right? Isn't that what he says? I think
thrombolysis. Yeah. So he's going to
Yeah,
put a
which is
catheter in
a
the
thing.
thing. It's definitely a thing. It's very, and it would
It's
be
not
kind of a
only a
reasonable
thing,
thing here.
It's a very reasonable thing.
What would otherwise happen is you would give a medicine called TPA, which is a clot lysing medicine, and it's a dangerous medicine. It's given in certain circumstances like this. I've given it in these circumstances, and it's basically there to try to dissolve that clot quickly. But the problem is it makes you bleed a lot. It can make you very susceptible to bleeding. And so, you give it only when you have to, et cetera. And it would be a very reasonable move. I have pushed this medicine in a CT scanner and definitely saved lives with it. And so
it's the move, but you give the medicine first and then.
That's not what Pravesh wants to do.
No, he wants to give him a stat IV direct Raman inhibitors. All right. Anyway, so first off,
what does that mean? Do we know
so no medical person ever in the history of the world has ever said anything like this. So you can't just
a hematologist wouldn't say that.
You can't just shout out this patient needs a stat intravenous class of medicine. I mean, you'd say they need this actual medicine for one. TPA is not a thrombin inhibitor unless I've got my pharmacology way wrong, right? I mean,
no.
So it's the wrong class of medicine. And when we give these types of medicines, I think unless it's leparudin, if I'm reaching back far enough, that's
worm spit.
Yeah. So leech, I thought it was leech spit. So there is a leech spit medicine, but that's for stable. Anyway, it doesn't matter. That's not this one. And then he wants to go straight to surgery to do a surgical embolectomy.
Right.
Yeah,
so because he looks in his chart and there's a vague thing about some platelet problem that he's had, a family history of it. So therefore, he says you can't do a transvenous procedure because he would bleed to death. But you could cut his chest open.
Yeah, none of that.
All right. So Pravesh is being a hero.
Yeah, he's going to take the guy to surgery to do a way more dangerous procedure while he's unstable. I'll throw that out.
What are they going to do? Suck the stuff out of his chest?
Yeah, they're going to do a thrombolectomy or embolectomy.
Yeah, which is some centers do that preferentially. So that is actually a thing. Yeah,
yep, that's what they're saying.
Really?
Yeah, they do.
Yeah,
but you're not going to send your unstable patient down to the OR. You're going to TPA him right there.
Again, not based on an intern.
We do a check-in next with Lily. That was the leukemia patient. It was from episode 1. And Dr. Hunter, the oncologist we just met earlier, wants to send her home. And Pravesh is worried because her white blood cell count was dropping again. There was an interesting, slow, dramatic pan over the reference ranges of the lab, but I couldn't make out what they were. So I don't know if any of that was true. But Pravesh is worried that she could go home and her white blood cell count might be low, but honestly, I'm going to be with Dr. Hunter on this one. She says, yeah, but if she stays in the hospital, she's likely to catch a worse infection here and she doesn't have a fever. So that's not wrong, honestly.
No, not at all.
It's
totally
correct.
True. Dr. Hunter actually is okay in this one.
So here's where I'm like, maybe Dr. Hunter knows what she's doing. But they interject that little bit here where, is it Nick sees the labs from earlier and thought that the white cell count was going down? It doesn't really matter clinically, honestly, at this point, but they're trying to set up this conflict between Nick and Hunter, which we will come back to. Surprise splenectomy time. The Congressman Dick Cheney character, by the way, they forgot that he broke a rib and now his spleen is shattered, or he needs a splenectomy. They need to take out his spleen because of trauma. Now, it does happen. I'm not saying you can't have a small splenic injury that evolves in the hospital over time to where you're like, oh man, something was wrong. But boy, they would have checked for this. And a congressman, when he hit the door, they would have put him through a CT scanner and then an MRI. Like, not because it's
because they were doing an echo and a cardiac catheterization. They missed it.
They would have done it all at once. And
he only had a ground level fall. So why would you expect? So here's the thing. What happens if this is what happened? He has a cardiac event, an arrhythmia. He falls, breaks a rib, punctures a spleen, bleeds into his belly, gets anemic, and that's why he had ischemia. And they missed it because they're stupid. And the people who wrote the show are stupid, and the consultant's stupid.
Okay.
So
all right.
But this builds the problem of, oh no, because he needs a splenectomy. That needs a general surgeon. Dr. Bell, the evil but incompetent general surgeon, is there. And we see his hand shaking in secrecy. And so now we have a new conflict, because he's going to kill the senator or the congressman by his incompetence. But that means we got to bring in our pinch hitter, our designated hitter, Dr. Okafor, the resident saving
It's the only surgical resident in the hospital, apparently. So Grace had a lot wider stable of residents. So he goes back and he tries to say, can you, she's again practicing in a dark room. All the surgical suites, by the way, really dark.
Yep.
Every surgical room I've ever been in has like 100 lights everything's lit up. All the surgery rooms in this show are like super dark.
Well, Okafor is in the dark room cutting or sewing up a bunch of mannequin arms. Like
yeah, okay, maybe. So, but like anyway, it's just a thing. But and then
she's always doing that. She's always like cutting
She's like-
fruit or sewing up fake
Yeah.
arms. That's why
she's like,
so
I'm not
good at it, right?
I'm not gonna save you because you threw
Good
me
at
under the bus
sewing.
before.
She's still mad that he threatened to take away her visa because he can somehow do that as a head
Yeah.
of surgery, whatever.
Yeah.
And
And so she's like, I'm not helping you. You suck.
he's on his own. The patient, unbeknowingly, is going to have a bad surgeon during his heart transplant. We take a quick spin by. Pravesh's PE patient made it out of the operating room, is unstable in the ICU, but I guess made it. So, okay, we'll come back to that one later. And now Micah is crashing. It's all happening really fast. So Micah, original heart transplant patient, is crashing, and they actually do it pretty good. Like, these are the symptoms I would have with worsening congestive heart failure, right? He's like, I can't breathe. It hurts to lay down. This would be a person whose heart is, filling their chest with fluid because it's falling behind. So I was like, okay, that's there is that. I'll give him a reasonable portrayal of that. And so now Conrad has to do something. So he's got to figure out a way to get Micah a heart, like without finding one on the street or whatever. And so Nick walks in on Conrad doing some sneaky stuff on the computer. He's got like a screen up with HLA haplotypes. And without getting too deep into it, those are just like biologic markers, proteins that they use to tell which organs might go with who. Like, it's sort of like a blood typing, but kind of an organ typing. They're proteins on your cells. And I thought, given everything else we've seen, that Conrad is changing the HLA haplotypes in the computer, and that's going to make the heart. It's like, this heart now has this HLA B27 haplotype because I put it in the computer. But no, that's not what they're doing. Basically, what happens next is crazy medical fraud.
Yeah.
You remember how he does this?
This is insane.
Yeah, switching the blood samples, and then
He likes
now that guy isn't a match for the heart that they had.
he basically breaks into the lab and cuts the
He
label off
sweet-talks
one
the lab
tube.
assistant.
Yeah, sweet talks the lab
With
assistant.
those red lips.
Yep.
And the
Conrad's.
creepy, it
And he,
was
like-
creepy.
Yeah, it was very creepy. And he commented on her earrings, and she's like, "Oh, you can go into whatever secret room you want and have access to all the blood tubes because I think you're cute."
And he's like, can
not.
I have the congressman's blood tube and this other patient's blood tube? And she's like, yeah, sure, why not?
Have all the blood tubes you want.
And he says, I have to make sure they weren't hemolyzed. And if you think
Right.
you need to go to the lab, the lab won't tell you something is hemolyzed 2 seconds after you sent it to them.
They will tell you. Yeah.
They will tell you. It's you. Dr. Conrad doesn't need to look at it to know it's hemolyzed, that the red blood cells broke apart.
Yeah.
'Cause,
So
he takes the lab samples and switches them so that now it looks like, at least in the computer, that the congressman is not a match for the heart that was supposed to go to Micah.
Oh, and they reran the samples. It's not like they just switched
Right.
the
No,
labels.
they
and
switched them
So they
again.
reran them.
Yep.
And then there's like, "Oh, good catch." But then the congressman, no, the cardiologist tells Dr. Bell that Dr. Conrad told him to check it to be careful. And so Dr. Bell has the look like, "Oh, Conrad's up to something."
Yeah, well, they
It
had already
just-
had that conversation where he was trying
Right.
to get Bell,
Mm.
to convince the mom to withdraw life support on the comatose lady.
Well, because basically he's like, there's another heart in the hospital, but it's in the coma patient from episode 1. And Conrad's like, well, Dr. Bell, you're an insufferably evil ass. Maybe you can go talk to this
No,
patient's family.
he said it's because you're a really good communicator. So
Okay.
he's like fluffing him up. But then he also said, because it's my patient and I can't ask for an organ for my patient for another one of my patients. I don't know if that's true or not.
I didn't know
Maybe it
either,
is.
but it sounds like it probably would be, honestly.
Could be, yeah.
And what does Bell do?
Dumb.
He's like, no, I'm not going to be nice. I'm not going to do that.
So that happens. But then the switcheroo happens. So then now he needs a heart for the congressman because it's a PR nightmare for the hospital, which also isn't a thing.
Right.
But like, do they think that news crews follow around hospitals, or like, what are they doing today? Oh, there's a high profile.
No,
you know,
there would be
that
a news
person
crew for like if there were a congressman admitted that was shot in
maybe.
the butt that needed a heart transplant, there would be
Yeah.
news crews.
Yeah, right. So
think.
they like want to do this and like have a good outcome. And
Yeah.
how about don't do the heart transplant? How about discharge him home because he's going to be fine?
Right.
You know, like
Right.
how about do a heart cath, maybe put in a stent with whatever artery was blocked, or do bypass surgery. There's so many things in between. and bypass surgery would be just as dramatic.
Yeah,
That's
no,
fair.
that's
That's
true.
fair.
But it doesn't set up the whole like the two
Conflict
hearts.
with
The
the
tube
hearts. Yeah,
switch.
that's the thing.
And then the telling the girl that who was a coma from the first episode that they had got to donate her heart.
Right.
And then
Well,
they gotta-
and so the final crux there was that because now they need to find a heart for the congressman and now one for Micah, and now they, of course, let's just pause for a second because it seems like everybody's organs match really
really well.
really well
Yeah.
in this
Mhm.
hospital. Like the odds of all these nicely matched organs within like a few hospital floors is astounding.
Yeah.
But okay,
Okay,
we'll go
so how
past
about this? So like the heart from the comatose lady matches Micah, and the heart from the other guy matches the other guy, but also matches Micah. So why wouldn't the comatose lady's heart match the congressman? And why couldn't this be like you're all gonna get heart? Like you know what I'm
Hearts
saying?
for
Well-
everyone.
Well, basically,
They all match each other.
the conflict here is that Bell knows that Conrad did something goofy in the lab. Okay. He confronts Conrad and he says, look, I know you did something, and boy, it would be the end of your career if I told you, blah, blah, blah. And then how does Conrad combat that? He says,
He's like, if you want to turn it into a scandal, be my guest.
yeah, honestly, if you're for a plot for that spot, okay, I can it's contrived, but that's not the worst. So basically what this makes Dr. Bell do is he's like, all right, I know he did something, but maybe I don't want the scandal. So I'll go ahead and do my best.
Keep
I'll
it
talk
quiet.
the heart out of the patient conversation with, the mob. And so it's sort of this one where now Bell and Conrad have one on each other, right? They do the surgical montage, which is amazing. The
The
surgical
chief
montage.
of staff and a 24-year-old surgeon.
Yes.
Yep, right, exactly. That's who. And then
25.
Conrad, the antagonist, just standing in the middle of the other one to receive the heart in his hands when it gets removed from the
He does.
Yeah.
I was like,
Micah.
what is he
And just-
doing there?
He's just standing there, and then they put his
And then the look on his stupid face, just like I can't tell. Is he taking a dump during the scene? Is he trying to cry? Like I can't tell because it was just zoomed
It'd be
in.
hard to act if you're just like looking. No, actors could probably act really well with just their eyes.
Yeah.
Is that true, Alba? Can actors act with their eyes?
Yeah, the actors
eyebrows just
can
went
act
up.
with their eyes. Yeah, that's I've spent a lot of time
Whoa.
practicing doing
Wow,
the wave
my
with
goodness.
my eyebrows.
You're
Oh, I
doing the
can't do
worm
it.
with your eyebrows. How-
Yeah, and I can do the wave too.
Wow, that's crazy.
Actors can act with their eyebrows.
Yeah. Okay. Yes.
that's amazing.
That's
Rest assured.
How
impressive.
did you do the inside out one though? Do that again.
Wow. That's
Listener, you have to leave it to your imagination for how cool that is. But it really is.
I am
Thanks.
flabbergasted.
But we're doing the
Right.
montage. All right, we're doing the
Right.
surgeries. Everybody's getting the heart they need. And I was okay. So when they're doing the surgery on, was it Micah or the senator, where they're going to do the heart transplant, but it looks like they're cutting into the abdomen. I know the one
Yeah.
guy's supposed to get a splenectomy. I get that, but I feel like in the scene it looked like they took the heart out of that cavity, right?
What-
It's almost like and it's because of like how they did it. Like they didn't use CGI, so like the guy probably was standing there, but you
Sure.
could have done it so much better. Yeah, it looked like his heart was literally 3.5 feet away from his chin.
That's
Anyway,
Like
yeah.
the person that wrote the scene has never seen a body before. The guy- you should just be like, hey, why don't you look up at the guy standing right in front of you? Okay, I want it to look like that, but with an open cavity.
Yep. Yep.
Oh, I could do that. These guys suck so bad. Oh.
It was they had the right kind of paddles to restart the heart. I think that is
They
how
did.
you,
I
you
think-
do it.
yeah, more or
So
less.
you actually, when you put the heart in, then you kind of shock it with these little spatula thingies to get it to restart. That
Yeah,
was
little mini
Special
paddles.
thingy.
But so Dr. Okafor is in the surgery to do the splenectomy, right? So,
Yeah.
but they have a little moment, Dr. Okafor and Dr. Bell, because
yeah. Are
he
they like
tells
friends
her
now?
there's an
They're being like
accessory
friends?
splenetic artery, which I was going to make fun of, and I looked it up, and it's a very archaic way of saying the splenic artery. So they found it
Yeah.
in some
Okay,
old
so-
book. Fine, okay, it's technically a thing they might say.
Oh my God.
And she's like, wow, you do know your anatomy. Maybe you're not worthless as a surgeon. And you kind of see they might form this like weird thing where like she'll do his surgeries. He'll
Well, because it'll advance her career. So
correct.
she's still
very
heartless.
career driven.
Yeah.
And
well,
okay,
which you
that's
have to
a
be
fair-
to be okay. So anyway,
Yeah. I was gonna say that's not super surprising. Maybe not to the degree that because Dr. Okafor's character also comes across as like sociopathic at times. when she's like telling patients bad news. So I don't know.
Yeah.
Mhm.
She
They're like, "Do you
calls
want me to go talk to him?" They're like, "No, no, no."
What'd she call the girl in the coma an organ farm?
Yeah, she did say that, which is
Jesus.
that's rough.
Yeah, I mean, I'm
Yeah.
like, come
Now,
on, it's not-
but see, again, that's the kind of stuff you could explore, like the dark humor and all of that stuff. But they can't because they're stupid.
Well, they would
Okay.
need nuance. They would need a lot of nuance.
Yeah, right. I mean,
and
that's
very good
there's
writing.
some material there, but all right. So then whatever's going on with Nick and Dr. Hunter. So they have a little little moment, I guess.
Yeah. So Nick is Lily, the cancer patient from the first episode, and the one who had the low white count, is going to be discharged. And Nick tries to stop the discharge. Kind of. She says like, "Oh wait, but Dr. Hunter, the white count was low," and Dr. Hunter's like, "No, I repeated it was fine." And Nick was like, "Oh." Mike's raising his hand.
He's so excited.
It was so dumb because she walks into the room and the room is empty, right?
Yes.
And then Dr. Hunter walks into the room and the room is empty. Why would either one of them go into maybe the first one, like, oh, she's gone. Like, didn't know she was discharged. But then Hunter walks into the room and there's a housekeeper in there cleaning.
Yeah.
And she said, you know, what happened to this patient? It seemed like a very fine interaction, and like very passive aggressively. Hunter was like, don't ever question me in front of staff again. But it was in front of the housekeeper who's not going to be medical, right?
Oh, I see. Yeah.
Unless-
yeah.
So I was like, wow.
Unless she
that's
was
a little bit
referring
much.
to the
time
scene
previous to
before. I
that.
think that's
Yeah.
what was happening. But yeah, the
That's
housekeeper
probably
was
what it
probably
was.
like, "Well, no, I saw the white count. It was 14,000."
Yeah, right. I wouldn't have sent her home, but hey, that's the attending.
But yeah, so the question it raises, all right, was Hunter lying or not? And again, clinically, if the patient didn't have a fever, it doesn't matter. You can leave a hospital with a low white blood cell count. You have to be vigilant, but you don't be in the hospital with a low white blood cell count.
And Hunter made the call. Hunter wrote the discharge.
Yep.
Hunter's taking the responsibility. Hunter's the oncologist. Hunter's the specialist.
Correct. Yep, absolutely.
She's allowed to do that. You don't know if there's shared medical decision making. And this
Yep. No, it's
dip
all
comes
very
in there
true.
trying to like, oh, and then you get into the like when they're in the computer and she's looking for the lab and it says file not found.
Yeah, I did like that.
Like,
So,
come
well,
on.
Nick is going to try to find the lab to prove that maybe she was lied to, and she can't. Like the file doesn't exist, which is like, no, it's not how that would
So
work. And what we're going to find
dumb.
out later, I'll just say it here, is that Dr. Hunter has her own medical charting system at her office, which is played out like a nefarious thing, but it's like, okay, yeah, that happens.
Kinda
completely
normal.
reasonable.
Really reasonable, but okay. Well, we're going to leave the hospital, except no, we're not, because diabetic foot guy is having a nice moment
Oh.
with his amputated foot, which is suspended in a
They
jar
put it
before
in
him.
a jar.
What?
They put his foot
Yeah.
that they amputated in a giant jar
On-
in
on a table.
formaldehyde and
He
gave
just-
it to him on a
That's-
table.
Hanging out looking at his foot.
A biohazard? Is that the word? That's a biohazard.
It is.
They would-
You
Yeah,
can't
this-
do that. You can't give somebody their amputated foot.
I don't think you can.
I don't think you can.
Okay.
So here's the thing. Look, I definitely empathize with this because if you take something surgically out or off of me, I'm gonna want it in a jar, and I'll probably put it on display in my house.
Oh,
But
yeah.
I'm a weirdo. It's not a normal thing, and I think I have asked, like, if you take out my appendix, can I have it? And the answer is no. It goes to pathology, and they dispose of
Yeah,
it
you
because it's a
can't.
biohazard.
That's
so-
not what you'd.
No, I mean, if I knew a guy, I'd try. I'm not saying I wouldn't try. Like if you amp my foot, I'm not going to say I wouldn't have my own foot floating in a
That
jar in my
reminds
house.
me, I need to bring my tooth up when I come.
Oh,
So
yeah.
I had that tooth extracted, and you
like
wanted it.
regurgitated.
Uh,
Wait, I'm just bringing up my tooth.
So
right.
Pravesh
And then-
comes in to bond with the patient. He brings him a pizza. So the running joke with this patient has been he's overeating. He doesn't care about his blood sugar. So Pravesh is like, here's a pizza and the patient's like, there's pineapple on it. Gross. And Pravesh is like,
the thing is, he still has another foot, Profesh. He still has another foot that could get.
And again, I empathize with the patient because pineapple on pizza is gross. But he's not going to turn the pizza down because he is who he is. And he's like, but if you take that pizza out of here, we're going to have words. And
No,
so,
kill you. Yeah.
yeah, Pravesh and the patient are going to eat and drive up his blood sugar together in a bonding moment. I don't know what this show is trying to do here.
No, right? And Profesh, he clearly has never had a friend. Like he doesn't even know how to interact with people normally.
Well, he's a medical student. That might be true. It's just not the
So,
move you
yeah,
would
it's
play
just-
as a
no.
intern who's worried about his
Pravesh
blood
is-
It's not a
sugar.
good look.
Also,
you
where
know?
did Pravesh have time on his day of independence after he took cyanide on 40 patients when he hasn't slept to go get a pizza for this guy?
It was probably delivery,
Yeah, he ordered it.
or maybe it was DiGiorno. I don't know.
Anyway, the best. Let's.
Get out!
Nice. That's so good.
Wow. Okay.
Is that delivery?
Get out!
We're at the end of the episode in a good old fashioned bar scene, which I kind of
Yeah,
appreciated.
I love. This was the best scene of the episode.
I actually agree with you. I think this was the best scene of this show so far.
Yeah, like do more of this, and I would actually maybe watch.
There's one piece I was trying to figure out. I'll pick your brains.
Okay. Well, so we're trying to tell a lot of story in this last scene, and we have some fun. Like Elliot, again, the other resident dude who's like kind of always the normal looking dude or whatever. His Riz, his game with women, is on display here, which he just walks up, yells, "Can I buy you a drink?" at a girl. She
Hey,
acts a little horrified, which I don't blame her. It was very weird and loud too. He was very loud about it, and she's like, "Okay." And then he doesn't order a drink. He orders like a soda water with lime. And she's like, "Okay, you're just feeding me alcohol and you're gonna," and he's like, I'm on call. "Oh, are you a doctor?" Boom. And now they're off and chatting. So Elliot's got to work with what he has.
But it never like that happened in like I kept going back like what did I miss? What did I miss? Like because then they're sitting next to each other at a booth like they know each other really well.
I think just the Riz was it was impossible to resist. He
But what are
just
they
rizzed
trying
her
to
up.
say there? Like again, you write a story
I don't
like
know,
Breaking
man.
Bad. Why was Breaking Bad so good? They wrote a story. They wrote a complete story. Why was why are all these other shows so good and this show sucks so bad?
I don't know, man.
It's because they don't even know what they're writing.
Well, you had a couple of fun comic beats. Like you had Dr. Okafor, the surgeon, sitting there at the bar. And this dude
Yeah, she
comes
gets
up
hit
to her.
on. Yeah, yeah.
He hits on her. He's like, "Hey, would are you a nurse?" And which all of our female colleagues as physicians get this line from everybody. And so she's like, "I'm a surgeon," and he immediately is completely emasculated and slinks off, which I actually kind of thought was funny. He was just like,
he like double taps the bar and leaves.
I'm in the wrong
He
league.
just doesn't even
See ya.
say, yeah.
Which we have some of these little fun things, and then we get Nick and Conrad having a dance, and they tease that something broke them up. They don't really tell you what it was. Okay, fine, it's all
It's
going
probably his
well.
lips.
And then here comes Pravesh, and we're gonna have
man.
a confrontation.
Oh man, this is right. So he like walks up to Conrad in the middle of the bar. And I mean, it was a hilarious. I mean, we've been watching. This is only the second episode, right? So this is a July intern, right? This is the greenest of
wearing
the
a sweater.
green, the dumbest of the dumb. He had one shift where he did a thing. So he comes up and basically says, "What does he say? Like, remember rule number 1? I broke it, and because you're
Okay,
not
so rule
always
number
right."
1 from episode 1 was that Dr. Conrad's always right, and don't question him. Which anyway.
Okay, like that's a bad rule anyway, so maybe it should be broken, but he's like sitting there talking to his senior like,
Well, the way it breaks down is Pravesh walks up and he's like, I handed out sign out on like 48 patients or whatever he had. And he at this point isn't mad, but then Conrad's like, "Oh, you think you're done with your Independence Day, blah, blah, blah. Well, you took this patient with the PE and you sent them for an invasive surgery and now they're in the ICU or whatever." And Pravesh has to defend that decision by, making up some bullshit. I'm just going to say it. Like, just makes up this whole reason. What was the reason?
That's right.
Yeah.
He said, I looked at the chart. You didn't look at the chart.
Because of the platelet thing.
This patient had a hereditary platelet dysfunction and they were at increased risk of bleeding. So, So first off, the fact that it said hereditary platelet dysfunction on the chart doesn't mean anything at all.
Sure.
So I don't even like.
What do you think they were getting at? I was trying to think this through. I think the only thing that would jump to mind is they were trying to say the patient had HIT, which is heparin-induced thrombocytopenia.
Or von Willebrands or
No, it's a clear call out, you guys, to Glanzmann's thrombasthenia. I mean, everybody knows that's what that would. I'm kidding. That is an actual. All the things we just talked about were platelet dysfunctions, and they're all
Right.
different, and
Yep.
they don't. So he's trying to like. The plot device was he has an increased bleeding risk, and you're a moron, you would have killed him. I read the chart and I saw this, and I sent him for this surgery, in which Conrad describes in the scene. It's like he had a thoracotomy instead of this mini-lane. But do you know what that is? That's where they like cut down into the chest and then splay the ribs apart, which is true. It's like a very invasive procedure. But then this comeback, you didn't realize he was at increased bleeding risk. So I saved his life by sending him to a surgery, and he would have bled if he had the other one.
That doesn't make any sense.
Yeah, none of it made sense. Because
doesn't
number
make
one,
any sense.
if the hereditary thing they were just vaguely saying made him more likely to bleed, I'm not saying that you can't have a blood clot ever, but you're not going to get one in
good
3
point.
hours of laying on your stomach, like anybody does when they go to
Oh
sleep.
yeah.
You're more likely to bleed.
Number two, I thought the reason I thought they might have been trying to hit heparin-induced thrombocytopenia, because it is one of these conditions where basically you develop antibodies, and if you see the anticoagulant, not see it, but like have heparin given to you, your platelets drop to zero, and you can actually form clots, and it's like super dangerous. But they might have used heparin, yes, but
Either way, though,
that wouldn't have counted against the TPA.
Right.
That being
Either
the
way.
major blood, but
they didn't give TPA.
Yeah, they didn't give it. But I'm saying, like, they can't even bill. This scenario doesn't make sense to me. I mean, maybe if somebody points out, if there are hematologists, I know we have one hematologist at least that listens to us. What familial condition would have made it so that you have to take them for a very dangerous surgery, but you can't give them any blood thinners because they're going to bleed? I don't know. I don't know what it is. Maybe it's out there. Maybe they found it at the back of the textbook, and that was it. But what this
was that
amounts
why they
to-
went with direct thrombin inhibitor instead of TPA?
Maybe, but
Oh,
that doesn't have anything to do with. Well, I guess
because
it
if you
could.
Google, I did this, dear listener. I Googled direct thrombin inhibitor because I wanted to see what they were after, and it lists that is the fondaparinux lepidolin class of medications.
Okay.
So that's the leach spit class of medications.
Right.
Those are the ones you use to treat HIT.
Okay.
So I think you're on to
So
something, Max.
but he would have been able to treat this without doing a thrombectomy, but he was unstable, so he could have given TPA, which also would have bypassed.
It's like
That's
medicine Mad Libs. They're putting things together in this weird jigsaw. I mean, the scene itself, I was like, okay, so these two are fighting. It was an okay fight. Like, if it were in German and I couldn't understand the words, I would have been like, cool, those two are kind of fighting a little.
Well, so the whole thing is that Pravesh may have, in the world of this show, he made the right call. No, he didn't. But in the world of this show, he made the right call. And so now Conrad's actually taken aback by the fact that he was challenged, and technically Pravesh was right. And so he says, well, you passed Independence Day, and now it was like, I was just testing you kind of thing, except the feeling you get was, no, he wasn't. He was actually, the intern did get one up on him, but now Conrad respects the intern, which, yeah.
Day 2. It didn't take long.
No, it was pretty quick.
1 day of pain. Well, what happens when Shark Week comes up? Is that going to be even worse?
Probably. It probably will be. But there you go. We end episode 2. Ooh, was not better than the pilot. Better than the pilot. So, I guess, closing thoughts? Do we think this was an improvement? Do we all agree this was not an improvement?
No.
Oh, this show is just...
What do you think,
It
Alba?
sounds like it was worse. It sounds like it was worse to me. Like the first episode, there wasn't stuff that I was like, that doesn't make any sense medically, But the second episode, hearing y'all talk, like the stethoscope with the tube and the funnel. Come on now.
That was great.
Why didn't he just put his ear on his chest? Like, that's what people
Exactly.
used to do.
Yeah, I get it. We appreciate everyone listening, and we'd love to hear from all of you out there. If you'd like to check out our merchandise or provide feedback, we can be reached through our website, www.horrorhistorianspod.com. There you can send us messages and find links to our social media sites. We do work to respond to all posts on our various social media accounts. If you want to participate in the show, use our site to send us a medical history trivia question. And if you have time, please go and leave us a nice 5-star review on Spotify, iTunes, or whichever platform you choose. And if you're a gamer or just want to hang out with Dr. Max, hang out on Twitch via the link in the show notes. Lastly, if you want to take your connection with our show to the next level, check out our new Patreon page for that brand new option. Until next time, Horror Historians are signing out, and me.
Oh, then he yeah, I guess then he blackmails the guy to try to convince the comatose girl who's brain dead to convince the family. And then he's like, this guy who's an evil guy, he's like, well, you can't tell a mother to pull the plug. And then you think he's got like this good arc. And then the guy, Dr. Red Lips is like, well, you just want her alive because you want to take her money. He's like, yeah, you're right. Essentially.
Okay. Mike just blew
So,
through
like-
like 5 scenes, but I love this
Yeah.
synopsis.
Let's pause here because like I got to put this
You
together
went-
in a
you
normal
went through
sense.
a bunch.
Yeah.
No,
so-
I thought we were doing the.
No, I know.
No, sorry. I didn't mean to be like we go through the entire thing in 2 minutes. I just meant we're gonna because a lot of what we said before
keep
was
I'm
moving.
so confused as Mike was talking, so I'm glad y'all said that.
All right.
I'm not keeping up.